Hello and welcome to this presentation of Marjorie, a visual analytic solution for finding and analyzing patterns in type 1 diabetes data. My name is Andreas and I'm a postdoc at the Visual Data Science Lab at JKU Linz. This is the team behind Marjorie. Anna, whose master thesis resulted in this work, my colleague Klaus, Marc, who leads our lab, and myself. And this here is Marjorie. Without her and her story, we arguably wouldn't be able to talk about the topic of our work today. Marjorie and other dogs were among the first diabetes patients successfully treated with insulin by Frederick Banting and Charles Best, and we named our work in honor of Marjorie. Type 1 diabetes is a chronic autoimmune disease. The immune systems of type 1 diabetes patients destroy the beta cells in the pancreas, which are responsible for insulin production. As a result, patients need to monitor their carbohydrate intake and inject the correct dosage of insulin to keep their blood glucose levels within a healthy range. Both high glucose levels, called hyperglycemia, and low glucose levels, called hypoglycemia, should be avoided. Our target group are patients who track their glucose levels through continuous glucose monitoring sensors placed under the skin and inject insulin through a pump. Patients require a small amount of basal insulin continuously throughout the day, and every time they consume carbohydrates, they need to calculate an additional correct insulin dose for the meal. This is called bolus insulin. An appropriate adjustment of therapy parameters requires a thorough analysis of past situations, which is usually done in regular time intervals with consultation of a diabetologist. We developed Marjorie to support doctors and patients in this joint data analysis. The data analyzed in these sessions is a combination of continuous time series and event data. Blood glucose levels are available as regular time series from the sensors. Carbohydrate consumption has to be tracked manually in the form of discrete log entries. The insulin pumps are programmed to provide a predefined basal insulin rate, and the additionally required bolus insulin is logged by the insulin pumps. One interesting aspect from a VIS perspective is that there exists a standardized visualization for the aggregated blood glucose data, the so-called ambulatory glucose profile, or AGP for short. It visualizes the aggregated glucose readings of multiple days or weeks across a 24-hour period using various percentiles. For the creation of Marjorie, we worked together with two diabetologists. We conducted 7 19-minute sessions to understand the doctor's current workflow and identify the most important analysis tasks. We identified 5 major requirements. Marjorie should help users to quickly and easily identify periods of low and high glucose levels, find recurring daily and weekly patterns, and assess all variables together in one place. And here the diabetologists mentioned explicitly that the AGP is not good enough because it only shows blood glucose data. Marjorie should also help users to bundle and compare similar data, which current tools don't support well, and view details for specific days on demand. We designed a combination of visual and algorithmic approaches to fulfill these requirements. In an iterative design process, we refined our designs based on feedback by the diabetologists. Our final solution is structured into 3 views. Here you can see the summary view. On top, it features the traditional AGP for the selected time range, enriched with carbohydrate and insulin event data. These are the blue and yellow barcode plots. The barcodes are based on agglomerative clustering of events and feature semantic zooming for more details. Below the AGP, users can request charts for the individual days in the selected time range. These charts are based on adapted versions of horizon charts, which highlight only the periods that are out of normal range. Times in range are simply shown as a green baseline because they are not important for the analysis. The panel on the right contains statistics that the diabetologists consider vital for their analysis. The second view, the so-called diary, simply shows the detailed glucose curve, carbohydrate and insulin data for a specific day. We made sure to use a consistent color scheme across the whole interface, and the statistics panel on the right serves as a legend for this color scheme. Finally, the Insights view visualizes automatically extracted patterns. Users can choose to analyze either meal or hypoglycemia patterns. For meals, certain time ranges before and after carbohydrate intake are considered, and for hypoglycemia, only time windows around periods of low blood sugar levels are considered. Using hierarchical agglomerative clustering with dynamic time warping, Marjorie groups similar situations together. The groups, or patterns, are visualized by overlaid line charts, an hourly aggregate strip, and additional charts for the carbohydrate and insulin events. Alongside each pattern, summary statistics are shown. Let's now hear from Anna, who will go through a brief usage example with real patient data.
The graph shows the ambulatory glucose profile, which is a visualization commonly used for diabetes data. It's an aggregation of multiple weeks of data over 24 hours. The sidebar on the right shows relevant statistics for this time frame, and we see that the patient generally has a good time in range of about 70% here in green, but has a problem with high glucose values, highlighted in purple. In the graph, we can observe that the patient has elevated glucose during the night. In the morning, the glucose is in range and relatively stable, but after lunch it rises again. We now want to explore the individual days in more detail. We here see an overview of the days that were aggregated for the profile above. The glucose is visualized by horizon graphs, so extreme values can be identified easily. And to see the detailed line plot, we can click on the expand button. Underneath, carbohydrates and insulin are presented in a heat map, where entries which occur within short time frames are summarized. Here, for example. We observe that during the night there are long periods of high glucose, and when we look at the evenings, for example here, we see that the patient often eats despite already having high levels of blood sugar, resulting in problematic nights afterwards. A particularly high glucose period occurred here on 26th of November, and we don't immediately see any reason for that here. And to look up the details of this day, we go to the diary view. Now we navigate to the 26th of November to observe the high glucose period that we discovered earlier. And we see that during the night, the basal rate delivery of the pump was interrupted, explaining the uncontrolled rise of values. Next, we navigate to the Insights view. Here, 4-hour windows that contain meals are extracted from the dataset and clustered by glucose similarity. This results in a collection of typically occurring glucose patterns during a meal. On the right, there's a filter sidebar that shows an overview of all the extracted data, and users can select a preferred time of day or a preferred meal size they want to filter for. And we can see, for example, pattern 3 shows a summary of situations where the glucose increased after the meal, but eventually returned to the initial value. We also immediately see a possible explanation for the increase when observing the pre-bolus time here. On average, the insulin was injected 18 minutes after the meal in this pattern, so a consideration for the patient would be to administer the bolus earlier. We now navigate to the Hypos tab, which clusters typical glucose profiles around low blood sugar incidence. And we see that there are two main patterns. In the first, which occurred mainly during the morning, the glucose levels are mostly within the target range before and after the hypoglycemia. And in the second, the glucose levels sink rapidly, enter hypoglycemia, and then return to high levels once more, probably due to binge eating of the patient. The conclusion that can be drawn from using Marjorie is that the patient's therapy quality is generally okay, but the hyperglycemia periods can be reduced.
We evaluated Marjorie in a case study with a patient who analyzed their real data in a similar way. We also conducted feedback sessions with the diabetologists and a second patient. In terms of opportunities for improvement, both patients and doctors would have liked to see even more data, such as exercise or sleep records. While it would be straightforward to include these in Marjorie conceptually, only a few patients tracked this data. Apart from these suggestions, the feedback was generally positive. Patients and doctors praised the inclusion of carbohydrate and bolus insulin events alongside the AGP, and they also liked the compact horizon graphs. Along the way, we also learned some lessons from our design study. Most importantly, we found that our domain experts preferred a simple design with carefully crafted additions to established visualizations. In early designs, we tried more complex versions, based for example on dimensionality reduction, that were not as well received. In the paper, we discussed many of our previous design iterations and why we discarded them. And that's it for Marjorie, our visual analytics solution which helps patients and doctors find and analyze patterns in type 1 diabetes data. You can try out an online prototype of Marjorie with a preloaded dataset under this link, and you can find our paper and all supplemental materials under the following link. Alternatively, you can scan this QR code, which will take you to the paper website, where you can find links to all resources. Thanks for your interest in Marjorie.